Chapter 3: Core Practices of Successful Labor Management Partnerships. The current system cannot do the job. Trying harder will not work. Changing systems of care will. Institute of Medicine and the Committee on Quality of Healthcare in America. Over the past 30 years, labor management partnerships have increased frontline staff participation in decision-making within manufacturing, technology firms, federal and state governments, school systems, and healthcare organizations. These joint activities have improved the quality of services and products and contributed to considerable cost reductions in the organizations that have adopted them. As already noted, after creating a comprehensive labor management partnership, Xerox reduced its manufacturing costs by over 30%. In healthcare, Maimonides Medical Center dramatically increased safety by reducing patient falls and hospital-acquired infections by 50% and improved overall patient satisfaction with hospital cleanliness by over 75%, with a cost savings of 45% in supplies. Current research on best practices of labor management partnerships conducted by American and European scholars, including the first author, and advice garnered from many practitioners of this method suggests that 7 LMP core practices led to successful outcomes. 1. Hiring an initial consultant familiar with the most effective methods for enlisting frontline staff and management involvement in partnership activities. 2. Developing extensive educational activities for frontline staff and senior leaders so they can understand why changes are needed and how productive change can occur. 3. Creating a social contract between labor and management that spells out clear ground rules, a defined structure for joint work and decision-making processes, and specific, mutually advantageous goals. When possible, the contract should include an employment security clause. 4. Developing internal consultants and coaches to support problem-solving work groups and teams. 5. Improving overall labor relations to encourage employees to work with management, contributing their ideas and advice. 6. Using sector strategies to identify known ways of achieving successful change. And 7. Creating an effective process for documenting results. Not every healthcare labor management partnership initiative focuses on all core practices at once. However, the core practices presented in this chapter serve as a basic roadmap for labor and management leaders in healthcare systems or in other organizations seeking to develop or deepen joint activities. We illustrate these core practices through 2 case studies of developing labor management partnerships in healthcare organizations. The first case study concerns the development of a labor management partnership at Maimonides Medical Center, a standalone hospital offering extensive outpatient services and actively interfacing with community groups. The second case study involves the labor management partnership at the Los Angeles County Department of Health Services, LADHS, the second largest public health system in the United States, encompassing 4 major hospitals and 17 ambulatory care facilities. As W. Edwards Deming, the quality control guru in the 1980s stated, "There is no instant pudding for transforming organizations. It is a marathon, not a sprint." We have tried to capture enough basic details from each case to illustrate the nature of these marathons and to describe how these core activities supported partnership work. We indicate the key roles that collaborative leaders have played in implementing these core practices.